All right. Welcome everyone so much to this webinar, Bringing Light and Heat, a health equity guide for healthcare transformation and accountability. I'm Grace Rubenstein with HealthBegins, and I'm just here to get us all oriented before we dive right in. This is really a landmark moment for us and our partners in creating this guide. We intend for this guide to really help health systems move toward equity with accountability, a practice whose time we really believe has come. We are here at our first live introduction of this guide with our partners who helped us create it. It was a collaboration in the deepest sense of the word. So to get us started, before we dive in, if I could have the next slide, just a few pointers to orient you to your screen. This webinar is being recorded, and we will be sharing the recording with you after the webinar concludes. We would love for this to be not just our presentation of the guide, but a dialogue with all of you. So we're going to use the chat function for that. You're all set on mute, but the chat is a place where we can all share questions, ideas, resources. In fact, we're going to test it out right now. Just for a moment. So one important thing is it's going to automatically set you to send your chats only to the panelists, but we would love for the dialogue to happen with everyone. So if you can take a look at your chat window now, click on that drop-down panel and switch it to panelists and attendees. That will make it so that everybody can see what you post there. Let's test it out. If you could post just your name and the organization that you come from as a way of saying hello. I will do the same myself, and let's see who all is here with us today. Love it. So many people sharing this presentation. So secondly, we are saving plenty of time at the end for a lively Q&A session, what we like to call a fireside chat with all of our panelists. And you can submit those questions in the Q&A panel. You'll see that down along the bottom of your screen, just a few icons over from the chat function. You can submit questions at any time during the presentation, and we'll be keeping an eye on that panel to share those questions with our panelists. And finally, this is a dialogue, and we are intentionally shaping it as a constructive conversation. So please be a part of that by bringing your respect and curiosity and joy as we go through these ideas and practices. Next slide. We are going to be live tweeting and conversing on this as we go. These are all of the hashtags, handles, that you can use if you'd like to join us there. These are also all of our collaborators whom I mentioned, to whom we are profoundly grateful and appreciative. And next slide, finally, I get to introduce our just stupendous lineup of panelists today. So we have Tanae Hamilton Franklin, Vice President of Health Equity and Stakeholder Engagement with Health Leads. She's also going to be our moderator for the hour here. Sadhana Devaraja, Managing Director of HealthBegins, my colleague here, and Jeremy Cantor, Senior Consultant with JSI, all of them essential partners in creating this guide. So with that, it is my privilege to hand it over to Tanae.
Thank you, Grace. Good morning and good afternoon and good morning, depending on your location and the time zone in which you're joining us from. As Grace said, my name is Tanae Franklin, and I lead our health equity and stakeholder engagement efforts for Health Leads. And today we're going to talk about bringing heat and light, a health equity guide for healthcare transformation and accountability. Next slide. So our learning objectives today, we have 3 of them. So first, to describe the 5 steps in a process that healthcare institutions can follow to advance health equity and racial justice. List and at least one example of a strategic goal in practice that a healthcare institution can adopt at each step in the process. And third, to identify multiple specific actions that could elevate accountability at each step of the process. Next slide. So we are excited to share with you today what has been a labor of love. Over a year ago, in our respective home workspaces, a few of us came together to develop a tool for everyone that engages with the healthcare system. Our goal was to develop an actionable guide that went beyond words on a page to providing a framework that is inclusive of players internal and external to the health system and sets expectations rooted in accountability. We set out to create a guide to provide healthcare leaders with guidance for how to deepen, broaden, and elevate their organization's health equity work. A team of us from HealthBegins, JSI, Health Leads, Human Impact Partners, and SIREN developed this guide with funding support from the Robert Wood Johnson Foundation. Our inspiration came from Human Impact Partners' Health Equity Guide, which was designed specifically for local and state health departments. Next slide, please. The rise of COVID-19, mass uprisings against police violence after Mr. Floyd's death, school closures, loss of jobs, and natural disasters. All of these served as a backdrop in creating this guide. Each week, every month that we worked on this reinforced to us the need and the urgency for healthcare transformation. On this slide are 3 statements that I think most of us would agree with. These statements and others that are similar are not time-bound. They span generations, speaking to what it will take to eliminate differences in health outcomes for everyone, regardless of race, regardless of income, and regardless of ability status. Images from the last year have forced us to reconcile how health and healthcare is reflected in our daily lives. Ultimately, we do not want people to die unjustly. Our shared goal in the healthcare sector and public health sector is to eliminate preventable illness and preventable death so that individuals can have opportunities for optimal health. Data shows us who is impacted by health disparities, and research illuminates the inequities that drive differences in health outcomes. We know the common denominators are factors in our society that impact health status. Some of these include the race of an individual, access to quality housing, access to food, quality food sources, access to quality education, and quality employment. We have displayed a tremendous response to the pandemic, and I say thank you to everyone that has been a part of that. For the last year and a half, we have focused on efforts on mitigation strategies, doing what it takes to help those that have been most impacted by the pandemic. We found new ways to provide food, new ways to teach students, provide housing for individuals without homes, to test for the virus, and to get shots in arms. We did all of these things because we wanted to prevent people from getting sick and dying from COVID-19. The pandemic was a wake-up call on many fronts, but in healthcare, it is a wake-up call that we have to do more, we have to go harder. So we're going to pause here for a poll question, a couple of poll questions. Next slide, please. So we're going to give everyone a moment to answer 2 questions in this session. So the first question is, what best describes your organization or association? So we're going to take a moment and let folks respond.
And Tanae, it looks like it's giving people access to both questions at the same time. So I think folks can go ahead and do them both while we're at it.
Thank you. Okay, and then the second question is, what best describes your role related to supporting racial equity in healthcare organizations? And for the second question, you might choose more than one response, so please choose all that apply. And we're just going to give it another few seconds for individuals to provide their responses. And we have a lot of people on the call, so I'm kind of excited to see what the responses are. Grace, how are we looking?
It looked like most folks who were going to answer had answered, so let's take a look.
Okay, great. Oh, wow. All right, so most people here are from outside of the healthcare delivery system and from the healthcare delivery system proper. That's exciting. Okay, and then for the second response, we see that, let me see, with regards to roles, most people are responsible for contributing to health equity strategy and also implementing and developing. Okay, so it's a pretty good cross-section, All right, so now you know who's in the room. Next slide, please. Now you know that who's in the room. Let's talk about who this guide is for. So before the poll, I left off talking about strategic responses to the pandemic. But for a moment, I want to sort of reimagine. What if we implemented upstream solutions, not just for COVID-19, but for all diseases and diagnoses? What if we created strategies proactively instead of reactively? What if our well-resourced healthcare systems insisted that subject matter experts from the community were part of the strategy team? What if the strategy team consisted of social justice advocates, policymakers, patients, and community health workers? What if these subject matter experts also included representation from all levels of the health system workforce? We have the ability to make that happen. To do this, we need to open the shades and let in the light so we can better understand what's keeping us from providing equitable health care. Once we see why we're getting stuck, that will provide the opportunity for us to craft or rebuild systems that benefit everyone. So yesterday, I had a chance to listen in on the Council on Black Health webinar on racial health equity, where Dr. Joya Perry, who's the president of the National Birth Equity Collaborative, shared her remarks. And two items that she mentioned really stuck with me. One, you cannot provide health care without being an advocate. So I want you to think about that for a moment, especially those of you that are in healthcare systems and you're providers. You cannot provide healthcare without being an advocate. The second point that stuck with me that she made was that the healthcare system alone cannot achieve health equity. We created this guide to be an actionable plan, not only for healthcare systems, but also for those who can hold healthcare systems accountable. Again, this includes advocacy groups, policymakers, patients, and caregivers. And you're going to hear more about accountability from Sadhna in a moment. Next slide, please. Although there are other health equity resources and guides for the healthcare sector, when we started with this work, we did not encounter any that fully aligned with values that are critical for transformational change. Throughout this document, you're going to see our values reflected, but I think it's important to name them. Health equity, racial equity, power sharing or ceding power, systems change, and accountability, all come together for a comprehensive approach for healthcare transformation. Now, I'm going to stop talking and I'm going to turn it over to my colleague Sadhna to provide an overview of the 5-step process and take a deeper look at what we mean when we talk about accountability. Sadhna?
Thank you so much, Tanae. That was a wonderful introduction, and I always love hearing you present, and always makes it a hard act to follow. So thank you for that, and especially for sharing those quotes that you heard yesterday from Dr. Perry, I think just thinking about all of us as advocates, kind of regardless of the role, or maybe because of the roles we play, is really empowering. So just also want to thank all of our collaborators, echo all of that for Health Leads, JSI, SIREN, and Human Impact Partners. This group has been really inspiring to work alongside over these past years for all the reasons you mentioned, Tanae, that really helped feed our work as we built this guide together. So for the next couple of minutes, I'm going to be doing a high-level overview of the light and the heat, the process and the accountability that we lay out in this guide. And I know there was a link to the guide earlier in the presentation. We'll drop the link to it as we go as well. And I'll really be pulling from the guide to share the key points to make sure we could all follow along the conversation. So the first step, the first part of this is bringing the light. So what we mean by that is really process. So we put forth these 5 steps. It's commitment, it's building capacity, it's assessing and strategizing, change practice and policy, and learning. And we really want to emphasize a few things before we kind of get into what those 5 things mean, which is, we really believe that a coordinated set of goals and principles, goals and practices is imperative. We need to have this as an integrated set. It's critical for building momentum and for ensuring high-level coordination and accountability through the process. It may be tempting to think of this as rigid, but it's not. Given that the work will take time, given that the work is messy, the process should be thought of as circular. And we tried to kind of lightly signal that in the graphic here. It's not linear. The learn stage will inevitably lead to revising the commitment goals and so on. There's going to be an interplay among these stages, but it's important to think of them all kind of at the same time. Because the work is iterative and responsive to context, institutions should be flexible in terms of where they're starting. It's going to depend on where prior work was and where priorities currently are. And for example, the assessment function, the assess and strategize function, that is going to be necessary to understanding what capacities to build on, and certain capacities need to be in place to conduct assessments. So this just really want to emphasize there's an interplay here. We don't want to look at this as completely stepwise, but this was the easiest way to convey kind of that integrated step. All of the steps will be important, and it's critical that we drive towards the changes that address inequities. So here are the steps, the first 3. And where we start here is commitment, building capacity, and assess and strategize. We have in here, examples of these strategic goals. They're a little more detailed in the guide itself when you click on that link and take a look at the guide itself. But these are examples to explain what we mean by commitment, right? It means making clear and explicit, and we reiterate this at for each of those examples. We want them to be clear and explicit commitments to internal stakeholders, external stakeholders, and about partnering and sharing power. So really making sure that everyone understands what the institution is planning to do and how they're planning to do it. Building capacity. That means building capacity to lead the effort, training staff, whether they're leaders or participants, and really building meaningful partnerships in order to do the work. We know that, especially in terms of sharing power, it's going to require community-based organizations who have health and racial equity at the center, and identifying opportunities with them to do that power sharing and decision-making. And then the assess and strategize stage will be conducting root cause assessments that could be using existing data to understand inequities, identifying potential changes that the organization can make, and really monitoring metrics to measure that impact of improved patient, organizational, community, and societal change efforts. And I kind of use those different levels because when we talk about change practice and policy, we divided it into those 4 levels as we're explaining through the guide. So there's this patient level. So examples may be things like making clinical encounters more equitable, really looking at the individual. On the organizational level, this is where you can alter practices and policies to hire and train a workforce within the organization, and make sure that there are policy changes across the organization related to that. That could be hiring, that could be retention, that could be pay, benefits, human resources, kind of across the board there. Then we look at the community level. There are practices and policies that can be impacted there. So participating in community-led and directed efforts. This is where partnership is really key, so that you're able to participate meaningfully in those, and to really maximize roles as anchor institutions, if you're part of one, to equitably impact the community. On the societal level, we have advocating for policy and systems changes, examples here. The final kind of stage here as part of bringing the light is to learn. And this is really iterative. We want to continue collecting data on metrics established during the assess and strategize step, identify progress, identify gaps in those metrics, share those lessons internally. You want to share them with other health systems and organizations, which will likely include competitors, with patients, with advocates. Really having transparency in terms of the lessons learned will be an important piece of learning and being able to land on effective approaches. And then review data and revisit the cycle. So revisit, commit, and build capacity and restart the cycle as part of your learning. So that was what the process that we laid out for bringing the light. And bringing the heat is really what I think was an energizing force in terms of pulling this guide together. So accountability, at HealthBegins, we hosted a webinar in April on institutional accountability. I'll do a little plug there for folks to watch that if you haven't already. And we go through some key aspects of institutional accountability. I'll review a little bit of that today. But really the function of accountability and bringing it into this guide was because we recognized and we heard and we know that it's not appropriate for institutional leaders to hold themselves accountable. This is something we've seen and learned from in all different sectors and international sphere, right? We know that accountability is not purely an internal function. It needs to be heat that's brought from kind of all directions. And so there are a variety of stakeholders, and to Dr. Perry's point, perhaps, is that, we all can be advocates and we all can be effective at holding healthcare institutions accountable. And that healthcare institutions, the members of healthcare institutions can be part of that heat in terms of trying to hold themselves accountable, but really have a really important role to play to enable and respond to those measures and to those to the critiques and to the suggestions that come in. So I do want to launch another poll here just to get a better sense from you all. How well are your local healthcare systems held accountable for improving racial health equity for patients and communities? And if we can launch that poll. We'd love to hear what you all think. And there's really two polls in one here. So the first is this question on how well are your local healthcare systems held accountable? And that's a current state kind of assessment. And the second question that's popping up is, to what extent are you and your organization ready to implement? I loved the poll that Tanae shared, where we saw that most folks see themselves as responsible for building these strategies. So would love to know your assessment on readiness as well. And I'm going to leave this open for a little bit. Looks like we have about half the folks have voted so far. See if we can get a little bit more going. And I see in the chat a suggestion that it would be interesting to see where people are located. Definitely locations, regions, communities can help enable some of these strategies and movements. So I'm going to close the poll now. And I believe you should be able to see these results. So it looks like folks tend to think that there's fair performance from local healthcare systems. And if folks want to, in chat, enter, how they responded and the location that they're talking about, that might help add some color to this. And then the second question, to what extent are you ready to implement? It looks like many folks have already started, which is so encouraging. All right. And I will do a little plug that'll come at the end, which is, we'd love to hear from you. We'd love to hear what you think is working and what you think can be improved as this guide continues. So that is great to see that there are folks that have already started, and it really ranges all the way through to haven't started the conversation yet. And I'd love to see what what folks who responded as other are thinking. So I'll stop sharing those results there and go back to the deck. And so these are the kind of 5 components of accountability. Again, we covered this a little bit more in depth in a webinar back in April. HealthBegins is hosting a series of roundtables with sponsorship from Humana and the Ripple Foundation on institutional accountability. These are the 5 kind of components that we've put forth related to institutional accountability, adapted from work by Professor Elnor Ibrahim. So community-centered governance, talk about individuals with lived experience and members of historically marginalized communities meaningfully participating in governance. I saw a question about power sharing, and this is really in relation to that, making sure there's clear mechanisms for shared decision-making, making sure that there's authority there. Redress is that stakeholders have helped identify the institution's own history of inequitable systems, that the institution's taken demonstrable steps. Dr. Michelle Morris, who is part of that webinar, has written about this, and it's kind of the potential there. Transparency and answerability. So to the points that we mentioned before, that data is being shared related to health equity and racial justice, that institutions providing rationale for decisions. Compliance, institutions actively participating in monitoring and evaluation, and then consequences. So are there clear mechanisms when shortfalls exist in outcomes or governance or transparency or answerability? And if kind of looking to see how government agencies and community-centered governance mechanisms have the ability to enforce these expectations. And so these are some of the examples going back through those 5 pieces. We put forth some examples of what accountability could look like across commitment, building capacity, assessment strategy, and then the other 2, especially since so many folks have started this conversation. We'd love, to hear your feedback on examples of commitment, reflecting understanding of historic institutional harms, that resources are clearly allocated. I know we've heard before, if show me your budget and I'll show you your values. So really expressing that commitment, building capacity, really is showing that these practices have been put into place. So increasing the leadership group, the clear mandate that they have, the necessary power to propose. And that time has been taken, that it's not expectations within a transactional timeline, right? That folks are giving things the space and time they need. And I'll go through to the next slide quickly, which is change practice and policy. So again, examples of what this could look like for accountability, and look forward to hearing from folks on this webinar and outside of this webinar on these measures for accountability, see what folks out there are doing, see if these resonate, see if these could be a possibility at your institutions as you think about bringing the heat, either internally or as external stakeholders. So with that, I'll conclude, and I will turn it back over to Tanae. Thank you all so much.
Thank you, Sadhna. We're not going to lose any time. Jeremy, I'm going to pop it right over to you to provide brief examples of strategic goals and practices at each step in the 5-step process. Jeremy?
Great. Thank you, Tanae. Wow, it's so inspiring to see all of you here. So many familiar names, folks I haven't talked to in a long time, and folks I'd love to talk to and connect with. Good morning, good afternoon. It looks like we have some folks from outside the United States, so good evening. Before I dive into the content, I want to reiterate the comments that Grace, Tanae, Sadhna made, that this is truly a collaborative effort. The three of us get to speak today, but it was the entire team's brain power and care that brought this together. And it was truly an example of the adage that if you want to go fast, go alone, but if you want to go far, go together. Yeah, this group has really brought light and heat, I will say, to me personally through a dark stretch. So thank you all. Let's go to the next slide. So I hope you'll indulge us. One last poll question. We really want to get a sense of who's here and where you are in your process. So the question here is, does your organization have a racial health equity plan? Let's post that poll. Okay, hopefully folks have had time to choose from that list. So I'm going to take a look at the results. Okay, interesting. So the largest group is in the, we're having some conversations about equity, and a number of others who are sort of in the process. So that's great. We hope this guide will help bump more of you from those categories, B, C, D, into E. And great to see that there are a large group who are excited. That's 64 people excited about the implementation of their plan. So we're really looking forward, as the other speakers have said, to engaging with you, learning from your experience as well. Let's move on to the next slide. So the last 2/3 of the guide is made up of strategic goals and sample practices for each of the 5 steps in the process. And Sadhna went over this at a high level. So I'm going to go over it in a little more detail, but I'm definitely not going to cover everything that's in here in 20 something pages of content in 5 minutes. Rather, I'm going to point out some key features and ideas that are embedded. First off, I'm going to say that the goals and practices here should not be thought of as prescriptive guidance in any way. This isn't a checklist, and trying to do everything that's in here at once would overwhelm even the best resourced process. The ideas that we're putting forward here are intended to inform, generate ideas and resonance in your own processes. And what makes sense in any context, any institution or community should be decided locally. And actually, I think coming back to that notion of accountability, that is a key step in developing accountability, that these goals and practices aren't imposed or aren't defined externally, but are agreed upon locally. Let's go to the next slide. So jumping ahead a little bit, and I've seen some of this commentary in the chat as well. Strategic goal 2.1 is all about forming a core team, an inclusive core team that includes internal staff as well as external community members. And not only forming a team, but actually setting up some guidance around inclusive decision-making, prioritization, that honor the perspectives of all those participants and get at this notion of true power sharing and power relinquishing, really, in order to come up with an equitable process leading to equitable strategy development. So really critical to get that kind of core team that has the resources and authority to move a process forward. Let's move to the next slide. And then under assess and strategize, I want to point out the focus here on impact and really orienting towards identifying metrics and measures that will monitor that impact over time. That it's, part of, I think what we're laying out here is a process, and there may be metrics that are useful to monitor that process, the extent to which participation is inclusive and broad and diverse, the extent to which trust is actually being built, to which power is being shared, and that there are metrics and measures that are focused on the long-term equity outcomes that we're all concerned with. I did see also in the chat, and I think we can come back to this in the Q&A a little bit, some questions about specific metrics and measures. And I'll say that there certainly are a lot out there. I do think this is another area where coming up with metrics and measures that make sense in a given context is really critical. Right? The metrics have to match the strategy, and the strategy has to match the context and what the priorities are. So there's all of this is part of a longer process of building capacity, identifying priorities that make sense in a given context, and then setting out metrics to achieve improvements on those priorities. But we can come back to this also and talk a little bit more about it. Let's go to the next slide. So Sadhna talked a little bit about this. I used to think of this, this change step, is really kind of the fulcrum of this guide. It's what steps 1, 2, and 3 have been building up to. And while 1, 2, and 3, we have the sets of goals and practices grouped together, and there's a real emphasis on that sort of forming a team and a coherent process that has resources and visibility and commitment. At step 4, we're talking about actually breaking out those goals and practices into these 4 levels: patient, organization, community, and societal. So we did this because the goals and practices at these different levels actually look pretty different and may involve different stakeholders and different planning processes, because healthcare institutions have influence at all 4 of these levels. And while that influence and control, I think, is strongest at the patient and organization level, and that's where a lot of focus and activity may be, in order to make significant progress on health and racial equity, it requires that we work at the community and societal level. And healthcare institutions actually have power and influence to make changes at that level as well. So to illustrate this, and the way in which actually these 4 levels can align and work together, in the guide we provide an example of aligned action. So imagine a patient shows up for an appointment with asthma symptoms. The clinician asks about their housing circumstances and identifies conditions that may be exacerbating their symptoms. So that's happening at the patient level. The organization level, that information may be recorded and built into an electronic health record. And the organization may have established partnerships with community organizations, local Department of Environmental Health, and others, both for the purpose of creating a pathway for referrals for a specific patient, but also to look at the data together to identify patterns. So that's at the organization level. Imagine in this case, it turns out that there's a cluster of patients with similar symptoms in one specific housing development. The healthcare organization and their partners then may work on policy and at the societal level to pressure local government agencies, elected officials, others to tighten housing regulations, pursue delinquent landlords, to improve housing conditions for all residents, and so on. So that's sort of an example of how you can imagine practices that cut across these 4 levels that would then align into a strategy to improve health and health equity. Let's go to the next slide. So as another example, at the community level, healthcare institutions can use their power as employers to create economic opportunities for local community residents. And this actually connects with sample practices at some of the other levels around providing a living wage, banning the box in applications, and as well as drug testing for employees. There are other barriers that healthcare institutions can sort of as a collaborative and comprehensive effort put together to create pathways and economic opportunities in their community. Let's go to the next slide. And lastly, I want to really reiterate the point that Sadhna made, that this is an iterative process. I think we all know, health equity is not a project. It's not a linear project with beginning to end. It's really a long-term commitment, and it's critical. And we try to emphasize this in the learn stage to create a cycle and to restart the cycle and create opportunities for collaborative thinking and learning and reflection. And then revision and starting back with commitment, capacity, assessment, strategy, and change, and so forth. Let's go to the next slide. So that was a very quick tour of the goals and practices. We really do hope that this will be a living document, that you'll give us feedback on what's here, that you'll share goals and practices that you've developed, and that we can continue the dialogue and build the practice around health equity work moving forward. Thanks again for being here, and I'll turn it back to Nate.
Thanks, Jeremy. So we are going to open it up to questions and answers. So remember to please drop your questions in the Q&A portal. And while you're placing your questions there, I'd like to thank our reviewers for vetting the guide and providing feedback based on their areas of expertise. And you'll see the reviewers listed here on the right side of the slide. But we do have the honor of having one of the reviewers with us during the Wired Side chat. Dr. James Kyle is the Medical Director of Quality, Diversity, Equity, and Inclusion at LA Care, and has a myriad of experience in working in hospital and healthcare industry. So welcome, Dr. Kyle, to the conversation. So I think we can probably stop sharing the slides now, and we can open it up for our conversation amongst our presenters and our guest panelist member. So the first question, Dr. Kyle, I'm going to direct to you. We have about 15 minutes, and so we're going to go fast. I'm going to merge my questions. I'm wondering, as a healthcare leader, what stands out to you about this guide?
Well, I think what stood out to me about the guide is its practicality. Wherever you are on the journey, if you're just starting, if you're midway or down the road, you can find something in this guide that will help you to either recast your vision, rethink your process, look at your methodologies. So I think while the guide is helpful, it was not heavy-handed. It opens up the ability for people to take from it what they need and move forward. I thought it was well written, and I think the audience will enjoy using this guide really as a tool with leadership and others to talk about a strategy. This racial health equity strategy has to be developed. And in best case scenario, it's not the job of one person, it's the job of the community to help develop that strategy. And so I think the guide points that out and gives you step-by-step how to walk through the development as well as to assess how well you're doing. So it's a great tool in our hands.
Okay, great. Thank you, Dr. Kyle. And I'm going to open it up to everyone on the panel. So we've already started getting questions, and one question in particular that I think is overarching for us to think about when it comes to getting started. What are the top, and this comes from Bridget Kelly, what are the top 3 questions healthcare organizations could ask themselves to radically dislodge them from wherever they are now and keep moving forward on advancing equity? I am going to use my point of privilege and express one of my responses to that question, and that is sharing power or ceding power. But I'm wondering what you all think, Sadna, Dr. Kyle, Jeremy, what are your responses to that question? And Dr. Kyle, you're probably going to be the person best positioned since you have been in leadership in this area. So
let me give you a quick answer, then I'll open up to the others. I think an organization has to decide if it absolutely wants to be relevant, because right now relevance requires radical rethinking of where we are. If we look at what we've been doing and how we've been doing it for the last 100 years, health disparities, racial health equity issues still persist and have gotten worse. So if we're going to be relevant to the solution, we got to decide first to be relevant. And that means to think outside the box and to be prepared for radical restructure, radical rethinking, and radical programmatic changes. And quite frankly, I'm afraid that many organizations are too fearful to become truly relevant to their communities.
Sadna, I'm going to call you in on this.
Yeah, I love that answer, Dr. Kyle, and thank you so much for your feedback during this process. I think that relevance question is great. I know Bridget asked for 3, and I was really struggling for 3 questions. I think relevance is certainly a great one. What I was thinking is for them to really think about what is your purpose and why are you here? And I think that that ties in with relevance and answering that question honestly. And if it's a business, and I think there's a business case for health equity, and is it ethics? Is it serving your population? And I think that those are kind of the threshold questions. And I'm hopeful that this guide can maybe present 5 questions in those 5 stages that we've presented for organizations to ask, well, what is our commitment going to be? How will we assess and strategize this? Well, how will we capacity build around this? So I think I'm hopeful that the guide leads to 5 questions, but there is this threshold question, as Dr. Kyle beautifully said, about relevance, and I think about purpose.
Great, thank you, Sadna. Jeremy, I'm going to pitch this next question to you. So right now we're facing the eviction moratorium being lifted, and housing advocates across the country are trying to make their voices heard and trying to move in that policy space. So I'm wondering how organizations outside of healthcare, community partners, or advocacy organizations bring heat and health to the healthcare institutions and advancing health equity. So practically, what does that look like? What have you seen? What is the intention?
Yeah, it's a great question and sort of an urgent, burning health equity issue that's on the table. And I would say, a couple of things. One, and this is, I think, sort of ties into Dr. Kyle's comments about relevance and Sadna's comments about commitment as well, is, I think healthcare institutions have been sort of tiptoeing into work on housing. LA Care more than tiptoeing, others. And it has been, understandably largely from the perspective of sort of patient populations and high-risk populations. And we're sort of at a point of crisis where, this is not a solution that can be handled on an individual basis. It's going to have to be it's going to be regional strategy. It's going to sort of be an all hands on deck response. And so I think healthcare organizations have to be ready to participate in that. And that means leveraging resources in different ways. And I think what we've been seeing in doing some work in counties in California around these issues is that there's a lot of resources, and what there's a need for is some flexibility and use of those resources, genuine strategy and collaborative work together, coming to the table as equal partners and as receptive and flexible partners, being willing to plug gaps and come up with strategies that really that are applied broadly and that really get to sort of population outcomes for a really broad population, and not just, again, not just sort of the high cost, high need homeless individuals, but there's a huge population right now who are at risk of eviction. So how does healthcare step into that space to do prevention work, to apply resources, right? There's not as clean an ROI case to say, okay, this individual right now is costly from a healthcare perspective, but we have a chance to reduce suffering, pain that is a wave that's about to hit. And so for healthcare organizations and community partners really to set a table for that dialogue and conversation.
So Jeremy and others, Sadna and Dr. Kyle, I'm wondering if there is no clear immediate return on investment, then how do we make this happen? We see in the chat that a lot of folks are focused on metrics. Everyone is looking for metrics to be able to justify doing this work and be able to determine if they've been successful in their strategy. So how do we think about metrics in moving towards equity? I don't think that there's a meeting that I've been in where there are clear and concise metrics to account for the goal to move towards racial health equity. Dr. Kyle, I'm going to come to you first.
It's such a great question. And here's, I think, the dilemma. Really moving towards health equity, while we've talked about it for decades, is new for us as a reality. Consequently, the metrics have not been created. That's why everybody's having such a difficult time trying to figure out how to measure it. We've never measured it before. And so we're still trying to struggle with that. So I think rather than going straight to metrics, that's how we've been trained, let's take a step back and ask some simple questions. Can you pull healthy people from unhealthy communities? And I would posit not very likely. So unless we're prepared to start asking questions about how do we invest in communities, then the ROI long-term metric is that we're going to invest in those communities, and then we're going to have healthier people that we care for and treat coming out of those communities. So I think we have to develop more of, instead of a Western mindset, more of an Eastern mindset, that we're looking at a decade of progress, not metrics that we move from year to year. How do we look at it from the long run? How do we change and invest in communities? And I think if we understand that as we go, we're going to be able to develop metrics that we can rely upon. But to sit in our offices today, create metrics for work that's not really been done, that's not been tested, it's going to be very difficult and challenging for us to do.
Sadna, do you have a response, right? Something you'd like to share?
Yeah, I mean, I love the phrasing of this is how we've been trained, right? I think that's, it connects with the quote you shared at the beginning, Tanae, from Ruha Benjamin, which is that some of this we have to reimagine. This is how we've been doing it. This is how we've been used to measuring. But we can think of new ways to measure. We can look at how measurements have kept us from achieving what we want, right? Because we're looking at the wrong thing. And so I think, metrics can be important, but we need to rethink about how we're measuring, what we're measuring. To Dr. Kyle's point, are we also looking at community level? Are we looking at societal levels? Can we be healthy communities in an unhealthy society with unhealthy laws and policies that extend beyond the communities? So looking at metrics, maybe not just in the traditional ones, maybe not looking purely at health outcomes, looking at more qualitative measures and thinking, using some of our radical imagination towards the metrics as well.
Thank you, Sadna. And Jeremy, you centered on the strategy. We have to have the strategy before we have the metrics. But before we have the strategy, we need to make sure that the right stakeholders are at the table. So there's a question in the chat: how do we best prepare and guide grass top leaders that this radical change can only happen if they support active voice and equal ownership? And so I know grassroots leaders, grass top leaders are doing the work, but how do we merge? What is that practical merge of that workspace, that collaboration, seeding power, sharing power? What does that look like on the ground?
Yeah, it's a really good question. I mean, I'd say sort of a bit of a blunt answer is we have to resource it. I think that work is difficult and it takes real skill, right? So we both have to resource it and sort of respect and build that capacity. So the the ability to sort of convene across disciplines, across sectors, to have that kind of mix of community organizing, entrepreneurial spirit that is needed to sort of be at the center of those sorts of efforts has typically kind of just been a bit of an afterthought. So I think creating more of both a sort of discipline and set of best practices and resource streams, so that work is honored. I've seen in a lot of collaboratives that there's a really critical shift that happens when resources are held by a grass tops leader as opposed to a healthcare leader, and that is part of that power shift. I think the other piece of it is there are ways, I think, actually back to our sort of discussion of relevance and responsibility for healthcare to be held responsible for facilitating those sorts of engagements, right? I mean, it would be entirely possible to develop a performance metric for, say, Medicaid managed care plans that related to supporting collaboratives and grass top leaders. And so I think there are ways in which we could also look for levers by which those sorts of efforts could be elevated, could be supported, and that we can create kind of a discipline across the country around that sort of work.
The next question, and this might be the last question depending on, but I would love to get everyone's perspective on this. How can we change existing health policies, such as hospital reimbursement policies, give incentives to hospitals to adopt these equity-based initiatives? I know for us at Health Leads, we have a project called Equity-Oriented Primary Care, and that is the goal, is to establish equity in primary care, but on the tail end, we have to make sure that it's paid for. So what does this look like? How do we have this conversation with payers? What is the incentive for hospitals to adopt these equity strategies, whether or not they're going to be reimbursed? And Dr. Kyle, I would love your perspective.
Reimbursement strategy is tricky. The people who make most reimbursement decisions are so far removed from the actual delivery of care that we're talking different languages. And so I think we have to really get with the major payers, such as LA Care, as well as the government at CMS level and CMMI, where we can go to have these conversations to reframe policy decisions around reimbursement. Reimbursement for most practitioners and hospitals has been an age-long challenge because we're asked to do more and we're paid less to do the more that we're asked to do. So, if we're really going to be serious about reimbursement, we got to have a high-level conversation that is informed by people at the front lines who can actually help explain the difficulties of these reimbursement decisions that are, I think, somewhat thoughtfully made, but misinformed about the realities of what we do.
Yeah, and I'd
like the next 15 seconds. Go ahead.
Yeah, just quickly tie that response into something that Annie Chang just put in the chat about how, this is a great question, and it's one that nonprofit community leaders feel like is a black box. And so I think, without having the answer to what that reimbursement mechanism is, I think one step towards the answer is those conversations, to Dr. Kyle's point, that the folks that are making these decisions are so far removed from the reality, and community leaders are very closely tied into the reality. And so I think really opening those conversations and being open to those conversations is an important first step to actually changing those measures.
Thank you. We only had an hour. It's not enough time, but it was enough time for us to at least have an introduction to this conversation. I encourage you, I know that the link has been in the chat for accessing the guide, so I encourage you all to go through the guide, read it, but we need to hear from you. Our aim to drive towards radical transformation is a path. We don't have all of the answers, but I know all of us together, we can get there. So the goal, again, is to advance health and racial equity by shining that light or determining what we have to go, and then bringing that heat and holding accountability. So for our final slide, before we close out, I just wanted to make everyone aware of 2 webinar opportunities that are coming up. And I'm trying to make my screen larger so I can see. So the first one, Beyond Do No Harm, Elevating BIPOC Voices and Social Determinants of Health Interventions. And then there's also a webinar with the Civic Health Alliance, Civic Health and Community Healthcare Settings and Congress. So we invite you to register for those. Thank you to all that have shown up. Thank you to my colleagues, and thank you, Dr. Kyle. We appreciate you being with us. Please don't forget to complete the follow-up survey. We love to hear your insights. There is an email address in the guide and info@healthleadsusa.org. Take action. Remember, we have to be the change that we seek, and we're in healthcare. That means we're advocating for healthcare. And stay engaged to learn more, learn how to move upstream. Thank you, and have a good afternoon.